Hi, everyone. Welcome. I'll give everyone a second to connect to audio. And as you're connecting to audio, if you could please put yourselves on mute. Okay, I'm going to go ahead and get started. Hi, everyone. So welcome to session 4 for CalAIM's Collaborative Planning and Implementation Group for the Northeast Region counties. This is our April session. Next slide, please. Just want to let everyone know that before we begin that we are recording this session, and a link to the recording and session materials will be sent out with our post-event emails. Next slide, please. Thank you. Again, if you are just joining us, I just want to say welcome, happy Thursday. And next slide, please. Okay, so before we get started, I'd like to kick some things off with some housekeeping items that will provide us with a great foundation for today's session. First, we'd like to invite you all to update your Zoom name. You can go ahead and include your name, your preferred pronouns, and the name of your organization so we can get to know one another and determine who is here. Second, to learn more about your needs and interests for today, as well as just learn a little bit about you, we'd like to know what is one of your favorite springtime activities. And so if the rest of the HealthBegins team and the EIC team can start dropping those in the chat to just encourage some participation from our participants today, that would be awesome. And then third, which is most important, we want to strongly encourage you to engage. This space has been designed specifically for you so that we can work together to make CalAIM a success. So in addition to posing questions towards the facilitators, please peer network, engage with one another, and uplift your experiences and needs. I'm going to quickly go into the chat and just see, I see some responses. So gardening, I love that, perfect for spring. I'm also seeing taking walks outside. I've been doing that every day and enjoying the sunshine. I hope the rest of you are also doing that. Some bike riding, can't get on a bike right now, but I do love that as well, Casey Ann. Picnics. Love that, hanging out by the lake. Thank you guys so much for participating. And I really encourage you to continue participating throughout the session. For those of you who haven't dropped in your favorite springtime activity, please let us know what that is. All right, next slide, please. Oh, thank you, Eva. So for today, we do have a few objectives. So before we move forward, I'd like to cover these. We have 3 objectives for today's session. These include, sorry. 1, by the end of the session, participants will understand how we will implement the 2 goals that we've developed by the Northeast Collaborative. The second is to shift from problem identification to problem solving. If you're not sure what that means, we will be explaining that throughout today's session, so please hang tight. And then our third objective is to self-select a focus area for your organization to prioritize as we move forward with implementing our work plans and moving forward in our goal implementation. Next slide, please. In order to accomplish these objectives, we've broken today's agenda into 4 parts. These 4 parts include our welcome and highlights. That's where we are right now. So that includes our housekeeping, session objectives, and agenda, as well as a quick recap of what's been going on in previous sessions. We'll also go through some solutioning. So this includes reviewing our goals 1 and 2. You'll get a little bit more information about those goals and what we are intending to achieve by the end of this year. And then part 3 is implementation. This is going to be the bulk of our session today. We'll focus most of our time in breakout sessions. And these will be split up between contracted groups and uncontracted groups. And then we'll close out with some next steps. We'll let you know what comes next. We'll share some immediate resources and just give a special thanks to our facilitators. Next slide, please. And I think now I'm handing it over to our co-facilitator, Vince. Vince, I'll let you take it from here.
Thank you, Melissa. Welcome everyone to the space. I just wanted to preview or provide an overview for you in terms of what we've discussed in previous sessions. And these are the following. Number 1, we have discussed the goals and background of the Northeast Collaborative Planning and Implementation Group and our shared norms and agreements. We've also developed our goals, which are our aim statements, and a project charter to align our vision together. Number three, we developed our driver diagrams, which are really our structured charts that show the primary factors that we need to influence our goals, and also develop a project charter to align our vision. Number three, we also develop our driver diagrams, which is part of what we're doing to show the high-level factors that influence what we need to do to achieve our aims. We've also developed a charter package, which is a toolkit of information that helps us to for planning, implementation, and evaluation. And finally, we've also developed measurement strategies, and these are really indicators for measuring our success. Lastly, we are also have developed the timeline and facilitation work plans for our implementation. I'll turn it over to Maiku.
Perfect. Thank you, Vince, for getting us started on that recap. Hello, everyone. Maiku Tao, part of the Everyday Impact Consulting co-facilitation team. Welcome to all of those returning, and to those of you who are new, welcome to you as well. Want to just share on this slide what we've been learning over the course of the 3 sessions that have taken place so far. So we are in session 4. And what we've heard from all of you throughout our discussions over the sessions. And so just starting at the top from sessions 1 and 2, we heard a lot around capacity building and workforce, and specifically, prioritizing and filling any workforce development gaps among providers, developing spaces and opportunities for peer-to-peer support, such as this collaborative effort here, and learning across rural counties and communities. For number 2, we've heard a lot around improved care coordination. And so, more specifically, developing cohesive coordination and improving partnerships and coordination with all system and key players within CalAIM and managed care plans as well. As ECM and CS providers, intermediaries, data and information hubs, and TA providers. On bullet 3, we heard around data sharing and workflows and systems, specifically improving upon current data sharing processes to help streamline data collection and reporting, and then also helping to determine feasible metrics for quality performance, and lastly, identifying technology solutions. Around sustainability and infrastructure, we heard from you all the prioritized need for sustainability of the ECM and community support programs, and working to establish and monitor long-term results and partnerships among providers and managed care plans. And then want to recap for those of you who weren't able to join us from session 3, some of those discussions included community education to drive utilization of these services. So there's 2 parts to this, education for beneficiaries. So wanting the state to help identify solutions to inform community about the services that they can access through CalAIM. And then also education for potential providers such as yourselves. And so really identifying and informing and creating a network of providers in order to make that care coordination happen. Bullet 6 here is about distributing information regarding provider networks. So working towards publishing these types of services that you all are already providing and offering to members. Also understanding which providers are contracted in each county, what the referral processes are, and workflow expectations. And then lastly, we heard around contracted groups, but also this unique group of stakeholders who are contracted but not yet rendering services. So we identified that there are a few providers who are contracted but not yet implementing services yet. And so what are some of those peer modeling practices that would help support if this is where you are in terms of your contracting process? How do we support you to be successful in that? And so I know I ran through that really quickly, just wanted to give you all a big picture of what has been covered over the last 3 sessions. It's just been really incredible wisdom and discussions that have taken place. And so I want to just take 1 minute or so, if you could just drop into the chat to let us know which one of these feel free to drop numbers 1 through 7 or a couple of numbers, but what are the opportunities which of the opportunities listed here are at the top of your priority list and what is resonating for you? So we'll take a minute there and feel free to put it in the chat. All right, I'm going to just verbalize something I've seen. So seeing number 1 with capacity building and workforce, 7 with contracted but not rendering services, 3 data sharing and workflows and systems, 7 again around contracted, getting contracted, 1 and 3 capacity building and workforce, 3 data sharing and workflow systems. That's great. Thank you all. Got quite a bit of a range of folks. Feel free to keep dropping in your answers in the chat, and we will go ahead and move us. Oh, sorry. Before we move to the next slide, also want to acknowledge that we were able to just make these one-on-one connections and want to offer it up to partners as well. We want to make sure that this is your space and we're being as supportive as possible. And so I wanted to also highlight that between sessions 3 and 4, we had a chance to meet with our Northeast providers and partners from Serene Health Group, Mom's Meals. We met with Shasta County, Visions of the Cross, and MedZed. I see some of those folks here, so welcome again, folks. Really glad to continue building these partnerships as we do this work together. And with that, Eva, if we could move us to the next slide. Okay, so for part 2, we're going to go ahead and start to walk through, the aims and objectives for today. So what is being shown here on the slide are the goals that this collaborative has come up with based on specific implementations that you all have unveiled. And so based on that, we were able to identify 2 goals. I'm going to walk through each of those goals here. So for goal 1 for this Northeast Collaborative, for contracted organizations and stakeholders that work with contracted organizations, the goal is that by December 31st, 2023, this Northeast Collaborative will work to advance the sustainability of community supports and ECM programs by adopting best practices pertaining to care coordination. Our goal is for 75% of participating organizations, such as yourselves, to implement at least one best practice to improve community supports and ECM implementation. So goal 1 really pertains to our contracted organizations here in the space. For goal number 2, this pertains to our eligible and uncontracted providers. And so by December 31st, 2023, our goal is to have 75% of uncontracted organizations, eligible ECM and community supports providers participating in the Northeast Collaborative that will have advanced at least one stage in your contracting process. So there's essentially 2 goals here that by December 31st, end of this year, we want to be able to accomplish what's here on this slide. And if we go to the next slide, following session 3, we were able to send along just a brief survey and Google form to partners just to really get some thoughts and feedback about how these goals are landing with you all. And so that was a part of really session 3's discussion. And so here is just your feedback on how these goals are aligning with the partners who were able to respond to that survey. For the contracted group, you'll see there is a 60. Oops, hang on, sorry, my slide is a little small. So we've got 66.7% in the contracted group who really align with the goals. We have 22.2% somewhat aligns, and then 11.1% aligns very little. So you can see for the contracted group, those goals are aligning with those partners. For the uncontracted group, we also asked the same questions about how this goal is landing for partners, and we have 75% who align with it really well, and then 25% who somewhat align. And so really based on these results, our teams were able to refine the goals to what they are today and what you're seeing in front of you, but wanted to just really appreciate the time that partners were able to take after session 3 to really give us that feedback and get you the final product today. And so with that in mind, I'm going to go ahead and we'll move on to the next slide here. And what we'll have you all do is, as Melissa mentioned, later today, we'll be spending a majority of our time in breakout rooms, in 2 breakout rooms. So what I want you to do is just after reviewing both the goal 1 for contracted and goal 2 for uncontracted, which breakout group will you choose to join for today's discussion? So if everybody could just take this time to go ahead and respond either a 1 or a 2. Again, goal 1 being contracted, goal 2 being uncontracted. That'll help us get you assigned into the right room. Okay, thank you all. And while could please continue to drop either a 1 or a 2 in the chat here, but I'm going to keep us moving along just so we can spend a majority of our time really in discussion with all of you. Could we also go to the next slide? All right. So what we wanted to do is just walk you all through, the process of how is it that this goal addresses the issues that have come up. So for our goal number 1, this is meant for our contracted orgs and partners here in this space. And what does a contracted organization means? It means you currently have a contract with a managed care plan and are providing ECM and community supports care services currently. And so I wanted to just voice over some of how these goals align with CalAIM's vision around whole person care, transitioning to a whole person care approach, around equity, and improving the quality and outcomes of our community members and reducing health disparities. And then number 3, coordination, improving coordination of services. And so really just making it easier for providers to work with one another to prevent any beneficiaries from falling through the cracks and just making an overall better patient experience. And so based on this vision around CalAIM, our collaborative has identified these priorities, outcomes, and impacts to address the issues identified in previous sessions. And so we'll just read right through here. So we saw what goal number 1 is, right, for our contracted partners. Some of the priorities that came out of those, what we heard from partners is workflows and processes, partnership development, capacity building, and technology and reporting systems. And so what is our outcome? Our outcome is to streamline delivery and drive utilization, thereby advancing the sustainability of community supports and ECM programs, and improved CalAIM community supports and ECM implementation. And then really, what is that impact that we want to make? The impact is to improve the care of Medi-Cal beneficiaries receive in our Northeast counties here. And so with that, how are we going to do that? How are we going to accomplish that? So if we can go to the next slide. What I want to share with you all here is just a visual of the different phases of where we are right now. And so we've just closed out problem identification, which is phase 1, and that included problem investigation, developing shared goals, determining the change needed, and then designing those measures. So that took place from January to March 2023 of this year. We are here now in our best practice adoption in phase 2. And so what we're hoping to do in today's conversation is defining best practices, baselining, having participants self-select improvements in the following areas, again, as they pertain to your organization, and then leaving today with some homework around what's called a PDSA. So we'll talk about that, but PDSA stands for Plan, Do, Study, and Act, really as a tool to help organize what your plan is to get to the goal for your organization. For the planning phase, in phase 3, that'll start in May. And our goal there is to
test effectiveness of best practices and identify any bottlenecks or challenges. And then the last phase, which will take us from June to December of this year, phase 4 will really be monitoring, progress measuring, and making systems recommendations. And so that, I know is a lot of information. We'll get to dive a little deeper when we get into our breakouts, but I'm going to go ahead and pass it to Vince to walk through goal number 2.
Thank you, Maiku. So for those of you who are uncontracted, these are explaining for you, the slide explains for you some of the things that we're looking at. For goal 2, as we stated previously, by December 31, 2023, 75% of uncontracted organizations will have advanced at least one stage in the contracting process, and we will discuss those stages in the breakout session. In terms of our priorities, we're looking at strengthening the collaboration and peer-to-peer support, also understanding the value of investment. We're also looking at capacity building. And lastly, increasing our contracting knowledge. The outcome that we want to achieve is to move providers in the uncontracted stage to advance one stage in their CalAIM contracting process. So as mentioned earlier, we will see those stages in the breakout session. And the impact that we want to achieve is to expand the provider network and care services available to Medi-Cal beneficiaries. Next slide, please. So how will we achieve this for our uncontracted group? So as similarly to what Maiku had mentioned, we have done a problem and identification segment from January to March of 2023. In quarter 1 of the project, we've identified and investigated problems. We have developed shared goals. We have determined the change needed, and we designed measures for success. In April, which is where we're at right now, through June 2023, this is quarter 2, we will be discussing baselining, basically where people are at. We will be adopting a strategy, aim to increase capacity and knowledge in the following areas: strengthening collaboration, peer-to-peer support, and understanding the value of investment, as well as capacity building and contracting knowledge. We will also have a little bit of a homework in terms of a document where we will ask you to plan, do, study, act, PDSA, and we can go over that a little bit more in the breakout session. In terms of quarter 3, which is from July to September 2023, we will look at contracting process and recommendations. We will also be testing effectiveness of processes and identifying bottlenecks and challenges. And in the last quarter of the year, from October to December 2023, we will take a look at the best practices and assessing outcomes. So those include monitoring, progress measuring, chronicling best practices, and developing systems recommendations. Next slide, please. So I'll turn it over to Maiku.
Great, thank you, Vince. All right, I know we've been talking at you for just the last couple of minutes here, so we're going to make sure that we're going to transition now to our breakout room discussions. And again, if you haven't dropped it in the chat, please let us know whether you will be in breakout room A, which is our contracted group, or breakout room B, with our uncontracted group. In your discussions for the contracted group, we'll launch phase 2 of the work plan by identifying best practices and existing processes in order to identify gaps and areas to improve. And so just wanted to give you all a preview of what's happening in that room. For our uncontracted group, led by Vince and Alexis, we will launch quarter 2 of the work plan by completing a readiness assessment that gauges where you are in your contracting process, as well as what areas of support you might need. And so wanted to just share what some of those previews are as we get ready to transition into our breakout rooms. I'm just going to do a quick check with Eva. Are we all good? Are we missing anybody who might need to be assigned a room yet? Wanted to just check in.
I think we're all good.
Hello. All righty, do we have everybody back? Looks like it. Great. So we're going to just start to transition to closing here. But before we do, just wanted to thank everyone for participating in just some really great peer-to-peer discussion and learnings across one another. We'll continue to build on these conversations, but if we can go to the just the next two slides. So the next slide, we've got a poll just for my group, the contracted group. And so Eva's going to launch the poll, but let us know based on our conversations today, right? Which best practice category will you commit to for your organization? Feel free to select as many as apply. But again, these are the 4 areas that that we discussed in priorities. So which one are a priority for you, or which ones? So I'll give you all 30 seconds to respond for those in my group, the contracted group.
And Maiku, I know that the group at large hasn't had the chance to hear from me much today. So hi, everyone, right before we break for the afternoon. I just wanted to uplift to the participants that we're so appreciative of how rich and fruitful the conversations that took place today were. We were literally sending each other messages on the back end about just how productive and how much information sharing was taking place and how much we learned from you and what your needs are and which key actions and best practices are really just like resonating and landing with your respective organizations. And so we're so excited about, you know, the plans that all of these organizations are going to take on and just being able to partner with you on bringing those plans to fruition. So I just wanted to like throw that out there, that these conversations were so amazing, and I almost shed a tear towards the end of our breakout room. So just thank y'all so much.
Thanks, Alexis.
I know there
Yeah,
were
go
a
ahead.
few more people in our group, so I'm wondering if you guys can just take another 10 seconds to answer the poll here.
All righty, we've got 5 responses so far. Just gonna move through those pretty quickly. So I'm seeing capacity building as we've got 3 for that. 60% of our poll so far. Partnership development is the second priority that's coming up for our contracted group, and then workflows and processes. We've got a couple folks there. So yeah, we can go ahead and, is that everybody? End the poll, share the results. Awesome. Well, thank you all so much again. I think that based on what you just shared, Alexis, I have the same sentiments. I think we had a lot of just really great in-depth discussions about what our partners are experiencing around some of the contracting challenges and moving to some of those solutions and best practices. So looking forward to continuing those conversations. And I'll go ahead and pass it to Vince to walk us through the next poll for the uncontracted group.
Thank you, Maiku, and thank you, Alexis. Poll number 2, please. So for those of us who were in our group in breakout session for uncontracted organizations, will your organization commit to taking a key action in at least one core area in order to support moving forward in the contracting process? Yeah, this is very easy. It's either a yes or
Right?
still.
I want to see everyone taking a key action.
Yes, that's amazing. So 6 out of 15 so far participated, and it's looking like most of you are yes and committed to taking the next step in the contracting process. That's amazing. And for those of you who are still deciding, as Alexis mentioned in our breakout, feel free to reach out to the HealthBegins team or any one of us if you have additional questions on how to move forward. So we will end that poll. Thank you again for that result. And moving on to the next slide.
All right, I'm going to go ahead and close us out in the next 2 minutes. So next slide, please. Okay, so we do have a couple of next steps, and some of you heard these in your breakout rooms, but next month's session will focus on sharing and receiving coaching on the PDSA plans that we discussed in our individual breakouts. And we have a couple of post-session event action items. So registration, please keep an eye out for those links. We do send 1, 2, 3 outreach emails as well as one-on-ones. And so just keep an eye out for those. We also have calendar invites that we share. So if you haven't received those, please just let us know and we can make sure you're added to the recurring calendar invite. Not on here, we are planning an in-person session, so there will be some communication going out about that. We are also offering scheduling one-on-ones with us between sessions 4 and 5 as partners are interested for support in completing the homework that we've assigned you. In addition to that, we'll be providing some office hours. So that information will be provided via post-event emails. We'll give you the times and dates on to when that's going to happen. And so that'll give you also an opportunity to connect with others. Yes, Alexis, yay homework, we love it. Session recording slides and supplemental materials will be provided via email. As always, you can contact Eva at healthbegins.org for any questions pertaining to the collaborative. She is our Health Equity Project Coordinator and sends a lot of our outreach. So she's probably who you've been receiving emails from. And then finally, support recruitment. So we did have a lot of great discussions today, and I know a lot of you have already started sharing emails amongst one another. But if there are people here or are not people who have attended, and you would like them to join us, please send their information to us and we will contact them and encourage them to join this collaborative. Next slide. Just wanted to do a special thanks to our facilitators. So we have the HealthBegins PATH-CPI project team. Thank you for our internal team. And the next slide. We also wanted to give a huge thanks to Everyday Impact Consulting for supporting as co-facilitators. Next slide. And that is it. So it is 3 o'clock. I will let everyone go. I know a lot of you have plans, but thank you so much for joining us. We really appreciate you being here. There are additional resources at the end of this deck that will be shared with all of you. So please keep an eye out for that. But otherwise, have a great day. Happy Thursday.
Thanks, everyone. See ya.